Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
Welcome to Healthy Happenings. My name is Paul Frizelle, and I'm a physical therapist at Advent Health in Wesley Chapel. Today, I'm going to be talking about treating dizziness with physical therapy. First, I'd like to give a little background about myself. Again, I'm a physical therapist. One of my major certifications is in vestibular rehabilitation. I've worked for several years with this type of patient population, and I work with a wide variety of patients who come in with these types of complaints of dizziness, vertigo, spinning. So it's a field that I very much enjoy working with. So one of the main questions I get from patients when they first come in is, why am I dizzy? So what we're going to look at to start with is some possible causes of dizziness when a patient comes to physical therapy. So the big question when everybody walks in for their first visit, why am I feeling like this? Some of the things that I commonly hear from patients when they first enter, they'll talk about their sensations as I feel a strong spinning sensation when I roll over in bed. And sometimes they'll say it goes away after I sit still for a couple of minutes. Some patients will say, I feel foggy, right? Almost like they're looking through a bathroom window is sometimes how they'll phrase it. Other patients will tell me when I turn my head quickly, I feel really dizzy. And then still other patients will come in and they'll say, I feel dizzy all day long, right? And I'm not sure why. So one of the biggest things that I've heard from patients over and over again is how long they wait to address these symptoms. And I think the biggest thing to really communicate is that it's very important, don't ignore your symptoms. Right? When you have these symptoms, it's not something that's normal. You want to get them looked at by a healthcare professional as soon as possible. So as we're talking and going through our evaluation, I'll talk to the patients about some of the potential causes of their dizziness. I think probably the most common thing that most people have heard about is called BPPV, and that stands for benign paroxysmal positional vertigo. Some of you may have heard of it referred to as the crystals, right? My crystals in my ear are out. That's BPPV. There are also a lot of other potential causes of dizziness, though, besides BPPV. Some of these include cervicogenic dizziness, which is dizziness that can be related to neck pain or neck and shoulder problems. There's vestibular hypofunction, which is a specific issue with the vestibular nerves. You could have an individual that has a cardiac abnormality, right? Something wrong with the heart and lung system. Also, stroke can be a potential cause of dizziness. Specific medications or medication combinations can cause dizziness. Low blood pressure. And then also vestibular neuritis can be a potential cause of dizziness. So as you can see, there's a lot of different reasons why somebody may present to a healthcare professional with dizziness. And you can also see why it's so important to have an appropriate evaluation done to examine where these symptoms may be coming from. So a second ago, I talked about BPPV, and the reason probably most of you may have heard of the crystals or BPPV is because it is actually one of the most common causes of dizziness. The important part about BPPV is that it does present with very specific symptoms, right? And the symptoms that somebody will have or that they'll tell you about when they have their dizziness from BPPV is they'll say, I get very, very strong symptoms of spinning or vertigo, and it lasts for 30 seconds to a minute, and then it gradually starts to go away. That's the classic description for somebody with that specific issue causing their dizziness. But something that's also very important to realize is that not all dizziness is going to come from the crystals being out, right? So this is where it becomes so important to communicate with your healthcare professionals and to make sure that you have your symptoms checked out, because many times they could be a symptom of a more significant issue. So many times when people go to their primary care physician or to an ENT or even to a neurologist with complaints of dizziness, they'll get a prescription to go to physical therapy. And, unfortunately, I've had many times where patients have come in and they said, yeah, the doctor gave me a prescription to go to physical therapy 6 months ago, and I just didn't really feel like it was going to help. So I thought it was important to let people know why they should go to physical therapy when they have these symptoms or when the doctor has recommended that this could be something to help them. So how can physical therapy help me? When the doctor recommends that you go to physical therapy for your dizziness, they will send you to a physical therapist that has a specific background and training in vestibular rehabilitation. And what vestibular rehabilitation is that it's the process of evaluating and treating somebody with complaints of dizziness. You could also, if you don't have the opportunity to see your physician quickly, you can also access physical therapists directly without a prescription in the state of Florida. So when you have these symptoms, it's absolutely important. If you're not able to see a doctor, a vestibular trained physical therapist can help to diagnose your symptoms and then either put together a treatment plan for you or recommend that you follow up with the appropriate healthcare practitioner. So specifically, when you are appropriate for physical therapy, a physical therapist who has been trained in vestibular rehabilitation will evaluate you at your first visit. And that evaluation process seeks to understand the cause of your symptoms. The therapist will go through, and then what they find on their tests will help them determine which tools that they're going to use to address your problem. After the initial evaluation, your physical therapist is going to create a plan of care that addresses the possible causes of your symptoms. The therapist will also go through and discuss the expected effects of treatment and how long they expect for you to recover fully. Finally, your physical therapist will communicate the findings of the evaluation and the plan of care to your referring doctor. Now let's look at some specific physical therapy tools for dizziness. So the first one, and again, since we've talked about it several times, putting the crystals back in place. There are specific ways of moving somebody around to help the crystals move back to where they're supposed to be. So some of these treatments are called the Semont Liberatory Maneuver or the Epley Maneuver. Your therapist will determine which one is most appropriate for you and then implement that treatment if it's indicated. There are also visual tracking exercises, which the therapist can provide to you. Balance and proprioception activities are often a mainstay in helping somebody recover from symptoms of dizziness. Some of these activities might include standing with your eyes open or your eyes closed, standing on unstable surfaces, or tracking objects through space, like tossing a ball back and forth. Gait training is also a big part of vestibular rehabilitation. And this is where the therapist will walk with you and create different visual targets that you may have to localize as you're moving. And then with some patients who come and present with symptoms that may be from cervicogenic symptoms or pain from the neck and shoulder area, your therapist may include treatment of the neck and shoulder region. These can include manual therapy or specific strengthening exercises for these areas. The goals of physical therapy are to reduce or totally resolve your symptoms. Also, we aim to provide you with activities so that you can self-manage your symptoms. We want to communicate directly with you and your referring practitioner about the outcomes of vestibular rehabilitation. And then finally, we want to educate you on solutions so that you can reduce your risk for the re-onset of symptoms at a later point in time. So dizziness can be from a lot of different sources. Probably the most common one is BPPV, which is dizziness from crystals that get into the wrong ear canal. Some of the other causes of dizziness include vestibular hypofunction, You can have cardiac abnormalities where somebody may have problems with how well the heart is pumping blood to the working muscles. You can also have medications that may mix with each other and cause dizziness, or may cause dizziness just by themselves. And you may have different things, one called vestibular hypofunction, which is a problem with the vestibular nerves in the ears, or vestibular neuritis, which is actually an infection on the vestibular nerve in the ear. All of these could be potential causes for your dizziness. Vestibular rehabilitation is the process of evaluating and treating somebody with complaints of dizziness. You will go through when the patient first comes in, and you'll talk to them about their symptoms, the time frame that their symptoms have onset, and how those symptoms may affect them on a day-to-day basis. Then from there, we'll go through in physical therapy and do very specific tests that are meant to help us understand what may be causing their symptoms, as well as what tools we may have to help treat those symptoms. One of the most frequent questions I get when patients come in is, why did I get BPPV? The simple answer is there's still a lot of research being done in this area, but some of the most current evidence that's out there does indicate that there may be the potential for vitamin D deficiencies to play into this. So this is something that you could discuss with your doctor as far as supplementation with vitamin D. There's also some research that's out there possibly connecting some different metabolic disorders, including diabetes or elevated cholesterol levels, with BPPV. But the evidence is still coming in, and we're still finding out more and more about this every year. One of the more interesting statements I get from patients is that they talk about how long they've managed their dizziness symptoms for, and they talk about, I just avoid the types of things that make me dizzy. The problem with doing that is that what people do is they start to avoid more and more activities. And eventually you'll see people come in and they'll say, I don't really leave the house, I've stopped driving, I don't exercise. And what that all contributes to is an increased risk of falls, poorer health quality, and poorer quality of life. So absolutely, these are not symptoms that you want to just try to avoid. They're very manageable, and they do very, very well when treated appropriately with physical therapy interventions. Thank you very much for watching this Healthy Happenings. I appreciate your time and hope you were able to obtain something from our presentation today.